typical Rolfing session starts with watching a person walk across the room. As Rolfers, we're trained to see the whole body and how it's moving in gravity. So we do a check-in walk, and it's an opportunity for a client to just do a body scan with their Rolfer. Rolfing the feet. It feels so good, and it's so important for the whole structure. Our feet carry us, and they have many motor neurons at the bottom, and to get the structure of the foot as healthy as possible has a myriad of benefits the whole way up. So here I'm Rolfing Heather's talus joint. This tibia and the fibula meet the foot here at the talus bone, and a lot of times people get stuck and jammed here. So to open this up and get what we call talar glide helps for the whole health of the foot and the mechanics of the leg. So yeah, I'm Rolfing away the fascia. As Rolfers, fascia is our expertise. So I'm focused on the fascia of Heather's foot here, trying to get individuation, any compression is getting freed up, any adhesions are getting freed up. And how does it feel, Heather?
Feels really good.
So it's like having a foot massage, but at the same time having very profound effects on the way Heather meets the ground and the way Heather is supported. The fascia of the foot comes all the way up the lower leg, so we always work the fascia in between the tibia and fibula to get optimal health in the lower leg and foot. As Rolfers, we see this as one sort of sock. It's all very connected. A lot of people get plantar fasciitis. Rolfing is excellent to help people with plantar fasciitis. Oftentimes it's in the calf and the soleus muscle here at the back that needs to be freed up and decompressed and get some hydration and mobility in here, and then that affects plantar fasciitis, which is at the bottom of the foot. So freeing up each bone, metatarsal they're called, as well as the joint. Here, sometimes with Rolfing, in order to get some of this deep fascia, we have to use our knuckles. But it feels great. It's not a no pain, no gain with Rolfing. I would only go to that layer of fascia that is available to open. There's no pushing through, but it is quite deep. Another way that we work on the foot is have the client bring their knee up and the foot is flat. So this is a great way to get all of that fascia underneath freed up and aligned. Oftentimes people have a myriad of foot injuries. They've gone over on their ankles, maybe a sprained ankle, and this helps to clear any scar tissue and any patterns that have been left over, some compensation patterns possibly, that are not serving a person anymore. Their ankle's healed, they don't need to have that pattern in the foot of sort of babying and compensating. They can get into just using the whole foot again. So this is a good way to get this ankle joint freed up. All the fascia can get really compressed and restricted. And our heel bone is called the calcaneus, and we're meant to have a little space. The calcaneus is not meant to be jammed in the joint here. So here I'm freeing up Heather's calcaneus, getting individuation in between the metatarsals. And then, because I'm a Rolfer, my expertise is the fascial layer, which is a continuous connection through the whole system. Even though I'm working here on Heather's lower leg and foot, I know I'm affecting the hip, the shoulder, and even the cranium, because it's one continuous connection through that needs to be decompressed and aligned. How's that pressure feeling?
Really good.
Yeah, so in a typical session, we want all of these bones and joints. There's 28 bones and 33 joints in the foot. And each of those joints is what we call a synovial joint, which means it has a little bit of fluid in it. So we want to make sure that those joints are not compressed. If a joint anywhere in the body is compressed, it's not going to operate as optimally as it can. So we're freeing up, getting space in those joints so that the foot can articulate when Heather walks. So let's see, we'll bring this foot down. So here I am on Heather's occiput, and this feels great when people have their head jutted forward from being on Zoom meetings or on the computer. And in a Rolfing session, I always end with the neck, freeing up and opening the neck. And I do gentle Rolfing. So here it looks kind of like this. So just go to the layer that's available. Does that feel okay, Heather?
Yeah.
And here we want to get all that tissue that's meant to be at the back of the neck to the back of the neck, because we tend to be so frontal. So we're opening and lengthening the fascia. As well, your hair.
Like I said, I was in front of a computer all day yesterday.
Yeah, there's a lot of people, a lot of clients are in front of a computer. Let's just free this up. So generally in a Rolfing session, I ask people to breathe into the area that I'm working on. Yeah. And if it's too much, you would let me know and I would back off a bit. It's not a no pain, no gain therapy.
I definitely feel relief.
Yeah. And your tissue's releasing too. And I can work really specifically or broadly. So here I'm checking your vertebrae, making sure mobility. With Rolfing, we want stability and mobility. So for the third hour in Rolfing, we work to differentiate the top half of the body and the bottom half of the body. And here we're going to clear Heather's head of the femur. This feels great on people, they love it. So we just sink into the fascia and we ask the client to breathe into it. So generally you leave feeling like you've had a massage, but at the same time there's a deep process of opening and realigning happening.
Yeah, that felt good.
All of a sudden that really opened.